insurance is supposed to be there for you when you need it. But depending upon your experience, that may not always be the case. Now, Medicare is supposed to be better, but is it? Hi there, as always, if you have questions, you can reach us in the comments below or at the number on the screen. Of course, there is no charge for our services. And please don't forget to like and subscribe. Now, you've paid a pretty significant portion of your paycheck to taxes to support Medicare, so it's supposed to be there for you for free when you retire, right? Well, not exactly. There's actually two parts to original Medicare. There's Part A, which is your hospital insurance, and Part B, which is your medical insurance, basically anytime you see a doctor. So there are potentially two separate premiums for the two different parts of Medicare. Medicare Part A actually usually has no monthly premium, $0 for most people, as long as you or your spouse qualify for premium-free Medicare with your work history. That would be 40 quarters, which works out to about 10 years. Now, if you haven't yet worked 10 years or 40 quarters, then there is a monthly premium. If you have worked less than 30 quarters, then it would be $505 each month for Part A. If you've worked between 30 and 39 quarters, so just short of that 40 quarter minimum, then it would be $278. Now, if you continue to work, eventually, if you reach that 40 quarters, then that Medicare Part A premium will drop off. Part B, on the other hand, always has a monthly premium, and that is determined by your income. So in 2024, the base Part B premium is $174.70. However, if you are a higher earner, then you could have a higher Part B premium. Now, Medicare is looking at your taxes from 2 years prior. So if you have recently retired and now you're making significantly less, then Medicare may be charging you an adjustment for really no reason. And if that's the case, you're going to want to file for IRMA, which is this form right here, SSA-44, IRMA, Medicare Income Related Monthly Adjustment Amount. If you file this form, then you may be able to get an adjustment for your Part B premium. Another big and unexpected surprise with original Medicare is the deductible. You're probably familiar with a deductible, as you've likely had it in your insurances in the past. Your deductible is the amount that you have to meet out of pocket before your insurance begins to contribute to the cost share. Again, with two separate parts of original Medicare, there's actually two separate deductibles. For Part B in 2024, the deductible is $240. This is once annual, and once you've met it, then you'll be responsible for 20% of the Medicare approved amount. Part A is where things can get uncomfortable and where you may start to feel like something's a little fishy. In 2024, the Part A deductible is $1,632. So let's just say in January you needed to be hospitalized for a knee surgery. You were out riding your bike, and where did that tree come from? Well, you've been hospitalized, you've met your deductible of $1,632, and then actually there's no additional coinsurance for the first 60 days if you need to be hospitalized further. But then in October, another bike crash. This time your shoulder needs surgery. You should probably pick up a different habit. But you've met your deductible for the year, right? Actually, no. The Part A deductible is actually applied per benefit period, which you can think of like a hospital stay. And that 60 days for a benefit period has long since passed, so you're going to need to meet that Part A deductible again. Yikes. When it comes to feeling like Medicare is a scam, nothing quite takes the cake like Medicare Advantage plans. And if you've had a Medicare Advantage plan that didn't work out for you, you know what we're talking about. Let us know in the comments below. Now, okay, Medicare Advantage plans are not really scams. However, they can be rather misleading, encouraging people to enroll in plans that aren't really best suited for their needs. Medicare Advantage plans are an alternative to original Medicare. They must offer at least the same benefits as original Medicare, but they're offered by private carriers. Additionally, these types of plans usually offer additional benefits to entice beneficiaries, things like dental, vision, hearing, prescription drug, and many more. And these types of benefits are not offered by original Medicare. Also, very often Medicare Advantage plans will advertise themselves as free, which they are absolutely not. But very often you can find plans which don't require you to pay any additional amount other than to continue to pay for your Part B. These private carriers are able to offer these additional benefits, often at no additional charge, because Medicare is willing to pay these Medicare Advantage plans to take on your medical risk. But it comes with a cost. These are managed care plans that operate within networks. Many people find it difficult to find specialists or hospitals who accept their plan and often report that they have to travel extensively to do so. Additionally, as I said, they are managed care plans, so you will need your insurance plan's approval for any treatment, test, or service that your doctor may recommend. Finally, there are Medigap plans. Now, some people feel like Medigap plans are a scam, and we 110% disagree. There are out-of-pocket costs with original Medicare. We've already talked about the deductibles and copays and coinsurance, but you should also know that there's actually no out-of-pocket maximum with original Medicare. That means that if you have major medical needs, you could wind up with major medical bills. So let's take a look at some of those costs of original Medicare and compare them with the benefits and costs of Medicare supplement plans. So first and foremost, let's go back to this page and look at some of those costs. So again, we have that Part A deductible. That is $1,632. And then there are copays or coinsurance. If you continue to have to stay in the hospital after 60 days, then it would be $408 per day. Days 91 to 150, $816 per day. If you needed to be admitted to a skilled nursing facility, so that is to say a place to recover after a hospitalization, this is pretty common. Days 1 through 20, there would be no coinsurance, but if you do need to stay 21 through 100 days, then that would be $204. So to put that in perspective, that's if it took you more than 3 weeks to recover in a skilled nursing facility from some type of surgery, basically. So you can see that if you were to have some type of surgery or medical procedure, then it is pretty likely that you would need to be rehabilitated somewhere for possibly longer than what Medicare would cover with no coinsurance or copay. And then, of course, there are those Part B charges. The Part B charges are nowhere as high as the Part A charges, but that's to be expected because Part A is for hospitalization, which we know is a lot more expensive than just going to see the doctor. Now, of course, Part B does cover things like x-rays and ambulance rides, and those can be rather expensive. So with Part B, you'll pay 20% of the Medicare approved amount. So look, none of us have a crystal ball, and in a moment we're going to be comparing some costs. I just want you to put this in your mind. Imagine that in 1 year you have to take an ambulance to the hospital, and that's in addition to any other medical bills that you might have. Okay, so an ambulance ride on average in the U.S. is like $450. Of course, it could be much more than that. So let's say you're paying 20% of that, which is the Medicare approved amount. So let's say we're looking at about $90. We're going to round up to $100 just to make things a little bit easier to keep track of. And then you have that deductible that you have to meet. That's $1,632. So again, let's just round up. And now let's say we're at $1,750. And now with all your other medical bills for the year, let's say for the rest of the year, you're pretty darn healthy, but 20% of all of those costs, let's say we round up to $2,000 out-of-pocket costs for the year. That's all your medical bills, and that's one ambulance ride and hospital stay. And that's just one hospital stay. So let's take a look at all of the Medigap plans. So there are 10 plans, varying levels of coverage and varying price points. A, B, C, D, F, G, K, L, M, and N. Plans F and C are not really being offered to new enrollees. So the plan with the most comprehensive coverage available at this point in time is Plan G. Now, there are some additional benefits, things that we're not even talking about in our comparison here, like coinsurance up to an additional 365 days after Medicare benefits are used. And that is huge, but we're not comparing that right now. So what we'd like to look at is the Part A deductible and the Part B coinsurance or copays. So all of the plans are going to cover Part B coinsurance or copays, with the exception of Plan K and Plan L are cost-sharing plans. So Plan K will cover 50%, Plan L will cover 75%. And then for the Part A deductible, almost all of the plans will cover it in some capacity, except for Plan A, which, if you ask me, that makes this probably not a great plan. So for today's video, let's look at Plan G and Plan N, because those are basically going to cover everything that we're trying to compare. So let's take a look at the Medicare supplement plans available. I'm going to put in a North Carolina zip code. We're just going to look at Medicare supplement plans. Okay, we put in some basic information, update price. Let's scroll down and take a look at these plans. So Plan G could cost you as little as $85 per month. So if we were to multiply $85 times 12, well, that brings us to $1,020, which is significantly less than the $2,000 that we could be spending in our example. Now, of course, if we were on the higher end of the spectrum, that $349, that would be all the way up at $4,188. That being said, of course, we don't have a crystal ball, as I mentioned, so you don't know if your Medicare supplement plan is really going to come in to save you from major medical bills or if it's not. Let's take a look at Plan N for comparisons purposes. Okay, so Plan N, a little bit less expensive, $74 times 12, $888. Again, much less than that $2,000 that we were using in our example. But of course, if you had a plan on the higher end, $302, then it brings you to $3,624. So there really is no way of knowing with 100% certainty if these plans are going to save you money, because you don't know if you are going to need major medical services, if you need surgery, if you need some type of treatment for an ongoing medical condition, unless, of course, when you turn 65, you already know that that's something that you are undergoing treatment for. In which case, you should definitely enroll in a Medicare supplement plan when you first turn 65. That being said, remember that with Medicare supplement plans in most states, if you enroll outside of that 6-month window when you first become eligible and enroll in Part B, you may be subject to medical underwriting, which means you could be denied or charged more, at which point you may not have as many options when you need more medical care. So the verdict is no, Medicare is not a scam, but many people can feel a little bamboozled when they haven't done their research, especially because the wording of so many plans, especially Medicare Advantage plans, can be so very difficult to understand. So if you do have questions, please make sure to reach us in the comments below or at the number on the screen. We are licensed health insurance brokers. We're licensed nationwide, and there's absolutely no charge for our services. As always, have a wonderful day, and thank you for watching. Bye-bye. Now, although Medicare itself isn't really a scam, there are some Medicare-related scams, and we've got a video dedicated to that, which I'll put right here. Let us know your thoughts in the comments below. As always, make sure to like and subscribe. We'll see you next time.